The Solidarity Fund was formally announced by President Cyril Ramaphosa on the 23rd March last year, when the coronavirus hit South African shores. Funds amounting to 3.22 billion rands has been pledged from a variety of donors. Over 2 billion rands of those funds has been allocated to its health, humanitarian relief and behavioral change pillars. Solidarity Fund CEO Tandin Zimande says donations continue to come in, with donations received having grown by 146 million rands in the last 6 months. The fund says it anticipates that it will see 1 million rands monthly into the account over and above the targeted fundraising drive in support of the national vaccine rollout program. She also says that the fund contributes mostly towards the health essentials.
We received funds from foundations, we received funds from political parties, from international sources, as well as a whole lot of local corporates, as well as many South Africans, many individuals. In terms of application, those funds have largely been applied to, under the health pillar, the ventilator project, the PPE, which was so necessary right at the beginning, and continues to be so.
The fund says it is in further discussions with the Department of Health to fund additional technical capacity in the mass national vaccine program. It says its role is to support and augment the national effort to curb and manage the spread of the virus.
The Solidarity Fund's role on the vaccine program is to augment and support the national effort being led by the National Department of Health. We know that to implement a vaccine program of this scale, and that has to be implemented really quickly during the course of 2021, we're going to need to mobilize and coordinate the efforts of the private sector, government, and civil society in a single national effort. The Solidarity Fund has contributed 50 million rand towards the J&J implementation study. And we have also, of course, made the covax down payment of 283 million rand at the end of last year. So that is the total we have spent to date directly on the vaccine program.
As the fund reaches its 2-year mark and the pandemic continues into its 2nd year, the fund encourages that even though vaccination programs are rolling out, the continued need for long-term behavior changes is still important as a part of personal defense system. Nothando Makutulela, SABC News, Johannesburg.